we have just found that when the word is getting out through the community rather than through official channels, people hear about it and are much more trusting.
How are we doing this morning? Good, good, good. Today is a very exciting day. A day that we get a chance to connect with our community on a more deeper level. I'm excited.
Essentially, the way that it worked is I turned to my community health worker team and I said, folks, we got to find community leaders in Johnston County. Who do y'all know? And then I reached out to them, everybody was supportive, and then it just came down to doing site visits to the churches and seeing, how's the parking look, how's the flow look. And Selma also came up as a focus because of the Johnston Health Hospital leadership had suggested it as an area that really they had not been able to do a lot of vaccine outreach to yet. It was an area that has a fairly high proportion of low-income folks and also Black and Hispanic folks, which are the populations we were trying to reach.
I want Andy to get the vaccine, but after I talked to my doctor, I changed my mind. I said I want to get it.
Because we could be skeptical, we don't know all the facts, but I look at this as a global thing, so it affects all nationality. I just want to do my part and try to stay safe.
That we have been working really directly on reaching these communities in other ways, not just this, so directly calling folks, and have seen, I think last week, our proportion of patients receiving vaccines who are Black went from 7% to 20%. So that to me just shows if you are intentional, if you try to reach these people, you can reach them. It's not an excuse to say, we just don't know why they're coming, you gotta go get them. So this is part of that effort of really addressing the access barriers that people have, so things like not being able to wait on hold for hours, not having good internet access, or just not knowing how to use the internet, not having a patient MyChart account, which is UNC's patient portal. But then also mistrust. The Black community in North Carolina and in this country has a history of being discriminated against and having things tested on them. There's that nasty history, and I think people still have that mistrust of the medical system. And so what we are trying to do is work through community partners who can speak to their community members more directly in a more trusted way and say, it's okay, this vaccine was not developed to test things on you. You really, really should get it if it's available to you. So that was really our goal with this mobile clinic, is to have trusted voices from the community talking about the importance of vaccination and also addressing just the pretty significant logistical barriers of scheduling a vaccine.
So remember, y'all, we'll just be back here again in 28 days and somebody's going to schedule your next appointment, okay? Who do we have back here?